Dear colleagues, allow me to present my report on obstructive urination in young men beyond diagnostic algorithms. The case report was prepared by Petrov Alexander, a urologist from the Petrov Clinic of High Medical Technology, Petrov St. Petersburg State University. Lower urinary tract symptoms caused by organic pathology mostly affect males over 40 years old. The most common cause of these disorders is benign prostatic hyperplasia, and nowadays we have sufficient information about this pathology. The guidelines clearly state algorithms of examination in typical cases. But in 30-year-old male with obstructive lower urinary tract symptoms, who was observed according to guidelines and neurogenic pathology was excluded, the cause may still remain unclear. Our opportunities in routine examination do not always provide a complete understanding of the cause of problem when it relates to young men. Such patients have been repeatedly treated for chronic prostatitis. They have obstructive uroflowmetry and high UP score despite of normal prostate volume. In some cases, patients undergo urethroplasty, which may reveal an extended urethral stricture followed by recommendation for surgical treatment. However, subsequent cystoscopy does not reveal any pathology. Then the question arises, what else should be done? Which diagnostic algorithm should be used? Which additional examination should be performed? Obviously, the problem can be either organic or functional. To retrograde ejaculation, that can be a critical complication for a young man. In cases of prostate cysts, the most reasonable solution is to perform bipolar enucleation because it allows to separate masses from intact prostate tissues as delicately as possible without significant thermal effect and carbonization. For young patients of childbearing age, the preservation of ejaculation and reproductive function is one of the most important challenges in this type of surgery. Histology, multilocular cyst of the bladder neck, Müllerian type, with a minor inflammatory component. This type of cysts is quite rare. We could only find 4 similar cases in the PubMed. This slide shows the result of uroflowmetry after 2 weeks. Algorithms for verification of obstructive urinary disorders in young males are required. Routine methods of examination mentioned in guidelines do not always reveal functional pathology. It is necessary to modify standard algorithms to make them functional, as we demonstrated on CT. Guided miction urethroplasty. In cases of prostate surgery in young males, it is necessary to preserve ejaculation.